Hello again, welcome to Medical Lab Science Quick Review, and our topic today is multiple myeloma for clinical laboratorians. Please stay tuned for the Q&A to follow. A malignant plasma cell myeloma in the bone marrow with abnormal neoplastic monoclonal plasma cells produce abnormal monoclonal antibodies called M proteins in an uncontrollable amount. A person with multiple myeloma is typically elderly who comes to the clinic complaining of a wide range of symptoms that relate to the bone neoplasm and systemic problems that ensue from a monoclonal gammopathy. Plasmacytomas cause bone erosion, which causes hypercalcemia. Excess immunoglobulins clog up the nephrons and glomeruli, causing renal problems. Anemia comes from the uncontrolled growth of immature plasma cells in the bone marrow, crowding out the erythroid precursors and megakaryocytes, causing anemia and thrombocytopenia. Patients complain of bone pain, especially in the spine, chest, or hips, where x rays may show punched out lesions in the affected bones. Let's focus on the lymphoid branch of hematopoiesis. Normally, plasma cells are found in the bone marrow, not blood. This is also true for patients with multiple myeloma, where they see abnormal plasma cells in the bone marrow. They appear as oval shaped with a perieccentric purplish nucleus, bluish cytoplasm, with a characteristic perinuclear halo that represents the Golgi apparatus and ribosomes that are busy making antibodies. Plasma cells are also called plasma B cells because they are white blood cells that originate in the lymphoid organs as B cells before maturation. Their sole function is to secrete large quantities of proteins called antibodies as an important part of the adaptive immune response to foreign invaders with microbes and antigens. From the blood plasma and lymph, these antibodies travel to the site of the target antigen. Flame cells are plasma cells with vermilion staining, glycogen rich cytoplasmic fibrils. They are not diagnostic of myeloma because they can be found in reactive cells as well as neoplastic plasma cells. A pathologist may guide us through and examine the bone marrow to find a predominance of atypical immature plasma cells. Multiple myeloma is a malignant plasma cell neoplasm disorder of terminally differentiated B cells. Sheets of immature aberrant plasma cells replace normal hematopoietic cells of the bone marrow. In serum protein electrophoresis, serum aliquots are applied to acetate or buffered agarose gel matrix, then exposed to an electrical current and field to cause proteins to migrate and separate according to their respective protein size and net charge. Albumin quickly migrates towards the cathode, followed by five major protein fractions. What protein abnormality do we see here? An M spike. Immunoelectrophoresis is a general term using principles of protein electrophoresis combined with precipitate reactions with antibodies, also known as immunodiffusion. Bands of immunoprecipitates are visible with Kamasi blue dye and measured with a densitometer. Urine protein electrophoresis of Benz-Jones proteins shows the light chains kappa and lambda. Normally, the light chain ratio is 2 to 1 to 1 to 1, with kappa usually greater than the lambda fraction. Immunofixation combines protein electrophoresis with immunoprecipitation. After electrophoresis of the patient specimen, we apply immunospecific antiserum to the five lanes using the SPE as a reference control. If antigen, which in this case is the monoclonal antibody, then we see precipitation bands, which show up after drying and staining. In this example, we see evidence of monoclonality, reporting IgG kappa. The heat precipitation test for Benz-Jones proteins is a historical test with a question found in the 7th edition of our ASCP study guide. Heating the urine will cause the Benz-Jones proteins to precipitate at 56 through 99 degrees centigrade. Then they dissolve at 100 degrees and when it boils. In flow cytometry, we can identify plasma cell immunophenotypes CD38 and CD138, as well as the monoclonality of light chains. At least three definitive criteria are needed for the diagnosis of multiple myeloma. A quick note about multiple myeloma in the blood bank. We have patients who are treated with specific targeted immunotherapy, the anti CD38 biopharmaceutical that attacks plasma cells with CD38 immunophenotype. In the blood bank, you may encounter these patients with pan-agglutination and the reagent antibody screening and panel cells, prompting us to send out to American Red Cross Reference Lab for antibody ID. A few notes about Waldenstrom's macroglobulinemia. It is a monoclonal gammopathy with IgM clonality, but it is not considered a type of multiple myeloma. Rather, it is considered a type of lymphoplasmacytic lymphoma of B cell origin, with paraproteins known to cause hyperviscosity syndromes and platelet dysfunction. And now for some Q&A that is similar to the ACP Board Certification Study Guide. Thank you for your time, attention, and your support in helping those afflicted with cancer.